So today we'll be talking about keratoconus with keratoconus expert Dr. Khanna and the most common questions with keratoconus patients. First question would be, why does keratoconus occur?
Keratoconus has multifactorial reasons. Most commonly accepted facts are that it is genetic in origin, and that's why it's clustered in families and in certain areas of the world. And the second, phenotypic interaction, that means environmental, most common of which is rubbing with the eye, rubbing off the eye, sorry. And if these two are present together, the incidence of keratoconus increases. Now we have to be careful. Sometimes if you're not even doing direct rubbing, but like contact lenses, like reverse geometry contact lenses can also give the effect of rubbing and not only cause progressive keratoconus but mask it too.
Who typically gets keratoconus?
So it's very important to know keratoconus starts in the teenage years, and it might start at the onset of puberty. So that's where our focus should be, to do early detection by color corneal topography and pachymetry distribution map.
And who can treat keratoconus?
So keratoconus is a corneal disease. So the best people who can do it are corneal experts, but even that has got super specialized, and people who are trained in the art and skill of management of keratoconus. That means they are experts in cross-linking, in tags, dog procedure, are the best people to go to for taking care of your eyes.
And can keratoconus be cured?
Yes, finally we've reached that step where keratoconus cure or at least progression can be halted with cross-linking. Till now we had contact lenses which optically improved the vision, or in tags which made the shape better, but both were not known to stop the progression. So cross-linking of the cornea with riboflavin is one procedure which can halt it. So we have to be careful when we use the word cure, because it can halt the progression, treat it, but it may not change the underlying disease itself.
Can keratoconus patients get lasik?
That's an absolute contraindication. No keratoconus or even partial keratoconus, known as form first keratoconus, should ever have lasik. In fact, we can even take one step further and say no family member of somebody suffering from keratoconus should have lasik.
And what are keratoconus symptoms?
The most common keratoconus symptoms we know are redness of the eye, irritation, frequent rubbing, and then driving we get glare and halos. And one very common way it may present, which might confuse the examiner, is kid in school may not be able to read and see the board well in spite of glasses. And there's frequent change of glasses, increased astigmatism, and vision is not sharp in spite of the visual aids.
And when does keratoconus stop progressing?
There's no magic answer, but it starts in the teenage years, progresses like wildfire in the teenage and early youth, and by the 30-40 years it slows down, and usually by 45-50 it's sort of burnt out. But we have to be careful, because there might be a few leftovers which might smolder and still progress, but generally above 35-40 it's slowed down tremendously.
How does keratoconus affect vision?
Keratoconus causes optical distortion, because the cone, and that's what keratoconus means, breaks the light and doesn't allow a sharp image to be formed. And also because there is a lot of scatter of the light, it can just cause a lot of fatigue and not being able to see clearly.
How do you prevent keratoconus?
There is no method yet of prevention. A lot of researchers are finding the genetic cause, and then that might be the answer. But we can prevent the progression by avoiding rubbing and cross-linking.
How rare is keratoconus?
So that's a very good question, because it used to be 1 in 2,000, But as our instrumentation has improved and we are able to detect keratoconus in more people, the incidence might be only 1 in 500 or even less. It's been fun talking to you, and I look forward to more questions in our next session. Thank you.